Dr. Shirazi. Welcome back to my channel. I'm a board certified dermatologist, and today I want to talk dark circles. I see a lot of patients coming into my office just really bothered by dark circles under the eyes. They are looking for ways to rejuvenate them. So I want to go through 5 different causes of dark circles and what you can do about them. But before we get started, don't forget to rate, review, and subscribe, and turn on your notifications to know when I upload a new video. Let's start with number 1, an ethnic normal variant. I really want to normalize having dark circles as an ethnic variant. In Middle Eastern, in South American, in certain ethnicities, in dark African American skin, we tend to have darker skin around our eyes, and it does get worse with time. So a quick test that you can do to see whether your dark circles are due to pigment, which is seen in ethnicities. So lie flat back and then hold a mirror up, pull your eyelid down, and if you still see dark skin and darkening there, then the pigment is in the surface of the skin, it's in the skin. It's not because of volume loss or veins or anything else. That's just a quick test to tell you it's due to pigment in the skin. So what can you do about that? You can do bleaching creams or creams with retinol, vitamin C, niacinamide. These sort of formulations are designed to lighten and lift pigment. I also find doing very low percentage TCA peels in the office every 6 weeks or so for 3 to 5 sessions will slowly and gently help lighten the under eyes. However, the way nature has it, certain ethnicities are supposed to have a little bit darker skin around the eyes. And so once you stop those treatments, you may see the beneficial effects go away. This is the type of dark circles that I think is really difficult to treat because you're sort of going against nature, and that eyelid skin is so delicate and so sensitive that a lot of times these creams, these bleaching agents, can actually cause inflammation, which then leads to dark circles, which brings up number 2, allergies, eczema around the eyes can also cause dark circles. Rubbing your eyes, getting flakiness, redness around the eyes can cause that skin to not only thicken, but also drop pigment, which is melanin, which is what gives you discoloration around the eyes, especially if you're darker skin. And so for that, you really need to treat the root cause. If you have allergies, whether it's seasonal allergies or you have eczema, be sure that you treat it right away, because the more you let it continue and the more you're scratching and rubbing and the more inflammation stays around in the skin, the more pigment that's going to get deposited in that skin and the harder it's going to be to reverse. If you tend to get teary eyes, use a balm that helps protect the skin against the tears, because tears can be very irritating because of the salt content, but also the skin is not designed to go from wet to dry, wet to dry. It will cause a lot of inflammation. And so protect that skin with just plain Vaseline, and use an anti-inflammatory like a cortisone. Soothe HC is one that's very mild and safe around the eyes. You can also use non-steroidal anti-inflammatories like Elidil, that's a prescription, or Protopic. It's really important to control inflammation, control allergies, to prevent that chronic inflammation and continuous pigment and thickening of the skin. Number 3, eye veins. You may have seen some people with this blue kind of deeper, larger veins around the eyes, and that can contribute to dark circles. And so there is a laser treatment that we do in the office using a special 1064 laser. Those that are very particular about eyes and can't watch these videos, you might want to just fast forward the video here, but it does eliminate those blue veins that helps with brightening the under eyes. So that's a procedure you can ask your dermatologist about. I specialize in that, and most of the time I can get the veins to go away in one session. However, it can take multiple sessions. These are just extra veins you do not need, so it's fine and safe to remove them. Right afterwards, you'll have a little redness and swelling, but it goes away within a few days to a week or so. Number 4 is thin skin. The eyelid skin is thin to begin with, but in some people it's even thinner. Just genetically, they don't have a lot of subcutaneous fat or collagen in their skin. And when the skin is thin, you can see the orbicularis muscle, which is right under that skin. You can see all the veins and blue veins, particularly in that area. So that causes a dark hue under the eyes. One way to help with that would be using a retinol eye cream to boost collagen in the skin. Fillers can also help, as well as laser resurfacing. The idea is to help tighten the skin, stimulate collagen, and give you a little bit more cushion and support in the skin so it's not as transparent. And you don't see those structures underneath. And lastly, volume loss due to aging. Not only just volume loss, I would also say loss of support and structure around the eyes, because as we age, we also see the ligaments around the eyes get stretched out, so they're not holding things up like they used to. And what that does is it creates a shadowing effect under the eye. Same with eye bags. If you don't sleep well, or with age you get thickening and protrusion of your eye bags, then again it can cause that shadowing that causes dark circles. And so you can use a filler, particularly Eyeglow, and you can watch this video here on that. Eyeglow is a white filler blend that's also opaque, designed to lift the under eyes, and the white nature of it will help lighten and brighten the under eyes, similar to how concealer does. And so that's an option for those with volume loss. Eye bags, a lot of times they can be caused by indulging in too much salt or alcohol or not sleeping. It can cause the eye bags to get very puffy. Also, using hyaluronic acid fillers around the eyes can attract and draw fluid to that area. So you have to be careful, because sometimes fillers are supposed to make dark circles better only in certain people, but they can actually worsen dark circles because they can cause that puffiness. So I hope that was helpful, and I gave you an overview of what can contribute to dark circles. It's not so simple. Sometimes it's a combination of things. But remember guys, if you are a darker skin toned and everyone in your family has darker skin around the eyes, I don't see anything wrong with it. It's natural, and I feel like we need to normalize it and accept it. I think it's a beautiful variant. It's not anything to feel bad about, because it's just the nature of the skin, and we should accept all these different variants. Thanks for tuning in guys. Comment below, let me know what topics you want me to cover, and don't forget to rate, review, and subscribe. I'll see you soon.